Okay, so let's start. Today we are going to start our first topic in general pathology. In general pathology, today we are going to discuss our first topic, that is growth adaptations. So before we directly start this topic, we have to first understand the basic principles. So first basic principle is that we know that in our body the organs are in homeostasis. So what is the meaning of homeostasis? Basically, it is a body ability to maintain or stable the internal environment despite external changes. So let's take an example to understand this. For example, let's suppose if the outside temperature is very cold, and we know that when the temperature in the outside is very cold, our body starts shivering. Why our body starts shivering? Because body is trying to maintain or going to stable the internal temperature, and it produces heat. So basically, when the temperature outside is cold, body starts shivering and it produces heat. And why it is produces heat? Because body is trying to maintain the internal environment as compared to external environment. So it is the example of homeostasis. Whenever there is change in the external environment, our body will try to adapt that change and try to maintain the internal, or we can say, environment of our body. So this is an example of homeostasis. So let's take it further. Whenever in the body the stress is placed on the organ, it lead to the growth adaptation. So what is the meaning of this line? Whenever in our body there is any kind of stress, when it is placed on the organ, that organ will undergo further changes, and those changes are called basically growth adaptation. So what is growth adaptation? You can say it is a type of change in the organ when the stress is placed on the organ or any kind of cell. So what are the changes that are included in the growth adaptation? So here I mentioned the changes that occur in growth adaptation. First one is the hyperplasia, second one is hypertrophy, and third one is atrophy, fourth one is metaplasia, fifth one is dysplasia, and sixth one is aplasia, and seven is hypoplasia. So basically, these are the changes which can occur in any organ, which can occur in any organ when the stress is placed on the organ. So let's discuss one by one these changes. So first of all, we're going to start the hyperplasia, hyperplasia and hypertrophy. So first of all, whenever we are going to discuss any term, we have to first define the basic definition of that term. Let's suppose now I'm going to explain the hyperplasia. So to better understand this, I just draw a simple diagram in front of you guys. So let's suppose, let's take an example. This is a cell. This is a cell in our body. And when the stress is placed on that cell will undergo further changes. Why that cell will undergo further changes? Because cell is trying to handle this stress. So whenever in our body there is stress on cell, that cell will undergo different changes. So let's suppose if you are going to put a stress on this cell, this cell has two options. First option, it can increase its size. So you can compare the size of this cell, and if you compare this cell size with that one, now you will see the size of this cell is increased. So it is called hypertrophy. So what is hypertrophy? When the stress is placed on a cell, and that stress can lead to increase in organ size, that is called hypertrophy. And on the other hand, let's suppose we will take another example to understand the hyperplasia. Let's suppose again this is an example of one cell, same cell. And now I am trying to put a different kind of stress. So when I put a stress on this cell will go undergo different kind of adaptation. So here you can see this is the one cell, but when I put the second stress on this cell is going to increase its number. So 1, 2, and 3. So cell has increased its number. So this is called hyperplasia. So the basic difference between hyperplasia and hypertrophy is when you are putting a stress on a cell, and after putting the stress on the cell, if that cell increase its size, it is called hypertrophy. You have to keep in mind, increase in size of a cell, it is called hypertrophy. And if you increase the number of cell, it is called hyperplasia. So this is the basic difference between the hypertrophy and hyperplasia. You guys have to keep in mind. And the these are the basic terms. If you guys didn't understand these terms, then it's very difficult when we discuss the systems. So there you guys don't understand the basic term. So that's why I try to like I am trying to explain all the basic terms in the first lecture, so that before starting the system, we must learn the basic terms or basic principle. So this is an example of, we can say, hypertrophy and hyperplasia. Now, another important question is, as I already told, in the hypertrophy, there is increase in the cell size. Now the question is, when the stress is placed on the cell, why it increase its size? What is the mechanism the behind that principle through which the cell is going to increase its size? So here I mention the basic, you can say, the steps which the cell will follow to increase its size. So here there are the three important steps which cell must undergo to increase its size. So let's suppose this is the cell. Take, I'm just trying to explain with an example. So this is the cell, and we know that in our cell there are different kind of cytoskeleton proteins. These are the intracellular cytoskeleton proteins which help to maintain the cell size, cell shape, or cell integrity. So that's about the cytoskeleton. So when I am going to put a stress on this cell will increase its size, and that is called hypertrophy. Now question is, how that cell increase its size? So basically you guys have to keep in mind, whenever you are putting a stress on the cell and cell is going to increase its size, before the cell size increases, cell has to undergo these three steps. So first step, the cell will increase its protein synthesis. Protein synthesis means these cytoskeleton proteins have to be increased. If you increase the protein synthesis, it means your cell size will increase. Now, we know that in our body, when we are going to start, or when we are making the protein synthesis, we have to activate certain kind of genes, and genes are present in every cell of human body. So that's why if you are going to increase the protein synthesis, you have to activate the genetic machinery of that cell. So this is the second thing. And the third thing, whenever the cell is going to increase its size, we have to increase the production of organelles. So basically, these are the three changes which will lead to cell size increase. Now, when the question, uh, let's suppose they are asking a question from you, and they are giving you one example. Let's suppose you are let's they will show you one example of any diagram. Let's suppose they will show you the picture of heart, left ventricle, and they will say, let's suppose this is a case of systemic hypertension. A patient has systemic hypertension, and you know that, let's suppose this is the left ventricle, and when the person has hypertension, it is a kind of stress on the left ventricle. So when a person has systemic hypertension, that hypertension will put a stress on the left ventricle. And we know that if the systemic hypertension is not controlled, it will lead to increase in left ventricular size. So that is called left ventricular hypertrophy. Now the question is, if they will ask from you how the left ventricle will increase its size. So you have to keep in mind, it is mainly because of increase in protein synthesis. And how the protein synthesis is increased, it is mainly because of gene activation. So this is the second point. And the third point, you have to increase the number of organelles. You have to increase the production of organelles. What is the meaning of organelle? It means you have to increase the mitochondria. We know that whenever a cell size will increase, we have to increase the number of organelles, mitochondria. So that's how the cell will increase its size. Now let's take an example. if the question, they can ask question from you, is that possible these hypertrophy and hyperplasia, these are the changes which are occurring in the cell, they can occur together or not? So this is a question which I am asking from you guys. Is that possible that the hypertrophy and hyperplasia can occur together? So the answer of this question is yes, it's possible. Hypertrophy and hyperplasia can occur together. So what is an example? Let's suppose you can take the example of pregnancy. In pregnancy, we know that the uterus size is increased. So if they ask from you how the uterus size is increased in pregnancy, so you have to keep in mind the two things. First one, we know that in the uterus there are smooth muscles. So the smooth muscle will undergo. Now the here one more important question. Whenever they are asking from you the how the uterus will increase its size during pregnancy, so you have to pick the both hypertrophy and hyperplasia, that uterus will go under hypertrophy and hyperplasia both together. So please keep in mind this thing. Then the second important thing, they can also ask from you, if there are some kind of exceptions in our body. Like let's suppose if I take the example of heart can only undergo hypertrophy. Heart can only undergo hypertrophy, it cannot undergo hyperplasia. So what is the reason why heart can only undergo hypertrophy, it cannot undergo hyperplasia? So as I already told you guys, hypertrophy means cell size increase and hyperplasia means cell number increase. So please keep in mind, cell number can only be increased if that organ has stem cell. Stem cell mean these are the type of cell which can produce daughter cell. So heart, cardiac muscle, and the neurons, they are called permanent tissues. Why they are called permanent tissues? Because they don't have stem cell. They don't have ability to increase in number of cell. So that's why heart, smooth muscle, and you can say like the cardiac muscle, skeleton muscle, and the nerves, they can only undergo hypertrophy. They cannot undergo hyperplasia. The reason is because these are the permanent tissues. They don't have the stem cell. Only those organs can undergo hyperplasia, those have stem cell. So cardiac muscle, skeleton muscle, and the nerve, they don't have the stem cell. That's why we say when the neurons in the central nervous system gets damaged, you can't make new neurons. Why? Because in the central nervous system, we don't have stem cell. It is an example of permanent tissue. So that is the thing you have to keep in mind. So here I mentioned which cells can only undergo hypertrophy. So here are the examples: cardiac muscle, skeleton muscle, nerve. So these are the examples of those tissues which can only undergo hypertrophy. And if they ask the reason, you guys have to keep in mind, we call these are the permanent tissues. And the permanent tissue definition is these are the those tissues which don't have stem cell. And if they don't have stem cell, it means they don't have ability to increase in number of cell. So if a thing can't increase in number of cell, it means it can only undergo hypertrophy. So that's all about the hypertrophy and hyperplasia. So let's take our view one time again. Now I will try to explain again with the diagram. Let's suppose this is the one cell, and if I am going to put a stress on that cell, you guys have to participate with me. So let's suppose if I put a stress on this cell, and this cell, let's suppose, become bigger. So what is called? It is called hypertrophy or hyperplasia. If you are going to put a stress on the cell and that cell will increase its size, then it is called hypertrophy, not hyperplasia. Then on the other side, let's suppose this is the same cell and again I put a stress on that cell, and now this cell will increase its number of cell. Let's suppose from one cell it will become, it form three cells. So it is called hyperplasia. So this is a basic difference between the hypertrophy and hyperplasia. When the cell increases its size, it is called hypertrophy. When a cell increase in number of cell, it is called hyperplasia. So another question they can ask from you guys, what are the example of permanent tissue? So first of all, you have to understand what is the Definition of permanent tissue. The definition of permanent tissue is those tissues which don't have ability to divide or replicate. Why they don't divide or replicate? Because they don't have stem cell. So this is a basic definition of permanent tissue. Then they can ask the example. What are the examples of permanent tissue? You can say the cardiac, skeletal muscle, then nerves. These are the examples of permanent tissue, and they can only undergo hypertrophy. So that's all about the first slide. I will send all these slides in your WhatsApp group. You guys can later on check. So here I again put a one diagram for you guys. So here I mentioned if the hyperplasia are not controlled, it undergo dysplasia or cancer. So what is the meaning of this line or term? So let's suppose I am going to explain with one example. Let's suppose this is the uterus. This is the uterus, and we know that on the uterus, the hormone which is going to work is estrogen. Estrogen is a hormone which is going to stimulate the uterus. So let's suppose if a female has increased amount of estrogen, that estrogen will go and stimulate the uterus. Now the uterus will undergo hyperplasia. It is called endometrial hyperplasia. So the question is, if that estrogen is not under control, if you are not going to decrease that estrogen level, that is continuously stimulating the uterus, and that can lead to permanent hyperplasia. And that permanent hyperplasia can go into the pre-cancerous state, which is called dysplasia. And from the dysplasia, it can become endometrial cancer. So they can ask from you one question. So what is let's suppose they will say if a female has increased amount of estrogen, they will give you an example of obesity. Like the clinical question says, this is a 55-year-old female. This female has like a BMI of 35 or 45. So they will ask from you, what is the risk of, what kind of cancer it can develop in future. So let's suppose we know that from the obesity, if you have more fat, the estrogen will be more. And if you have more estrogen, it will go and stimulate the uterus. And if the uterus is continuously stimulating that hyperplasia, if not controlled, it will progress into pre-cancer state, which is called dysplasia. And that dysplasia can become the cancer. Now, I want to share one important thing. There are some kind of exceptions in our body where the hyperplasia sometime is not going to dysplasia. It means sometime in our body, hyperplasia is not going to becoming pre-cancerous state like dysplasia, or it is not going to become a cancer. So what is the example of that exception? Can anyone from all of you please comment in the chat box? What is an example of that exception in which hyperplasia is not going to become a cancer? So that is the example of prostate gland. Prostate gland, you know that it is only condition that can develop in a man. Prostate gland is not present in the female, it is present only in the men. So it's mean that condition will develop only in the male person. So in the prostate gland, we know that there are smooth muscles. So when the testosterone amount is increased in our body, that testosterone will go and stimulate the prostate gland, and prostate gland can undergo prostatic hyperplasia. So the question is that prostatic hyperplasia can become a cancer in future? The answer is not. So please keep in mind, benign prostatic hyperplasia will not increase the risk of cancer. That is an exception. You guys have to keep in mind. So please remember this example. This is the example of hyperplasia. Now take another example of hypertrophy. So let's suppose if the person has hypertension. If the person has hypertension and that hypertension is going to put a stress on the left ventricle, and we know that if a person has hypertension, that hypertension can lead to left ventricular hypertrophy. And if the hypertension is not controlled, that left ventricular hypertrophy can lead to left ventricular failure. So it's mean if you will not control the hypertrophy, it can lead to permanent organ damage. Like here I explain, it can lead to left ventricular failure. So please keep in mind, these are the examples which can ask from you guys in the exam. Here is the diagram, simple to help to understand you guys. So this is the hyperplasia on the left side and hypertrophy on the second side. So here are the four number of cells. And let's suppose if you put any kind of stress on this cell, so you know you can see from here these are the four cells, but the difference is that these cells has increased their size. So when the size increase, it is called hypertrophy. And on the right side, you can see the size is same. Size is not increased, but the number of cells are increased. So this is called hyperplasia. So these are the simple, you can say, terms: hypertrophy, hyperplasia with example. I hope you guys you understand this. But if any student has any question related to these terms, you guys can ask on the WhatsApp group which we have made for you. So let's discuss the other term or other growth adaptation that is called atrophy. So first of all, we have to understand the definition of atrophy. What is atrophy? So again, let's suppose we will take an example of one cell. Okay. So let's suppose here is the one cell, and I am going to place any kind of stress on that cell. So this is the normal cell, and after putting the stress, you can see that the size of the cell is decreased. So this is called atrophy. So I will again explain. After putting the stress, if the cell size increase, it is called hypertrophy. And if the cell size is decreased after putting the stress, it is called atrophy. So atrophy means when the organ size is decreased. So the question is how that organ size is going to be decreased. So please keep in mind there are two methods. There are two methods through which can through which organ can decrease its size. One, it has to decrease its number of cell, and the second, it has to decrease the size of cell. Let's suppose if they ask from you the question in exam, through how many mechanisms cell is going to decrease, yeah, simply they can ask how the organ is going to decrease its size. So organ can decrease its size by two mechanisms. First mechanism, by decreasing the number of cell. Second mechanism, by decreasing the size of cell. Now they will ask question from you this, like how the cell will decrease its number of cell. So this is through the apoptosis. Apoptosis basically it is a programmed cell death through which the number of cells are going to be decreased. And if the number of cell are going to be decreased, it will lead to decrease in organ size. So please keep in mind this is an important MCQs. They can ask from you guys how the cell can decrease its number. It is through the apoptosis. This is how the number of cell are going to be decreased. Now let's discuss how the size of cell is going to be decreased. So size of cell is going to be decreased by two mechanisms. First one mechanism is ubiquitin proteasome degradation pathway, and the second mechanism is autophagy of cellular component. So let's discuss one by one what is ubiquitin proteasome degradation. So first of all, what is ubiquitin? Basically, ubiquitin is a protein, and proteasome, basically these are the organelles which are present in our cell, and these organelles have, you can say, destructive enzymes. Those enzymes can damage the proteins. Those enzymes can destroy the different things. So we know that in the proteasome there are different kind of hydrolytic enzymes, and those enzymes help in degradation, help in breakdown. So you guys have to keep in mind the cell size is going to decrease by two mechanisms. First one is ubiquitin proteasome degradation pathway, and the second mechanism is autophagy. So let's try to understand these terms with the help of diagram. So here I have made the two diagram. First one is the ubiquitin proteasome degradation pathway, and the second one is autophagy. Let's understand. So this is the cell. Let's go. This is the cell, and inside the cell there are the cytoskeleton protein. So let's suppose if this cell is going to decrease its size, how that cell will decrease its size? So basically, whenever the cell is going to decrease its size, in the cell there is a one protein which is called ubiquitin. That protein will come and bind with these cytoskeleton protein. When the ubiquitin is bind with the cytoskeleton protein, that cytoskeleton protein will go to the proteasome. The cytoskeleton can only go to proteasome when it is bind with the ubiquitin. So it's mean ubiquitin is a kind of factor which help to move the cytoskeleton proteins into proteasome. And when the proteins are going to proteasome, we know that in the proteasome there are destructive enzymes. Those enzymes will destroy the cytoskeleton protein, and when the cytoskeleton proteins are destroyed, our cell size is decreased. So this is how the ubiquitin proteasome degradation pathway works. Now let's discuss the autophagy. Autophagy or autophagy, you can pronounce as you like. So let's take an example again. This is the cell, and inside the cell there are some kind of vesicles. So basically, when I am going to put a stress on this cell, that cell is undergoing atrophy. Atrophy means it is going to decrease its size, and we understand this. Organ can increase, or an organ can decrease its size by two mechanisms. One, by decreasing the number of cell, which we say it's through apoptosis. Second, by decreasing its size. And how the size is decreased? First one is ubiquitin, proteasome degradation pathway, and the second one is autophagy. How the autophagy will work for this cell? So whenever that cell is going to decrease its size, it will start making small vesicles inside, and these vesicles will go into the lysosomes. And again, lysosome, these are the, we can say, organelles which contain destructive enzymes. So these vesicles will go into lysosome, and the lysosomes will destroy these vesicles, and this is called autophagy. So autophagy, basically this is a process in which a cell will undergo a vacuole formation, and these vacuole will fuse with the lysosome, and those lysosomes will produce hydrolytic enzyme, and those hydrolytic enzyme will destroy the cellular components. So this is the second process which is called autophagy. So basically autophagy simply mean it is a process of cellular component degradation in which cell is going to form the vacuoles, and those vacuoles are going to be fused with lysosome, and when the vesicles are fused with lysosome, those lysosome will destroy the cellular component. So that's how the cell size will decrease eventually. So that's all about the atrophy. So please let me know again if you guys you didn't understand anything. Let's take a quick review uh, until what we studied. So let's suppose this is the one cell. So please, you guys have to participate with me. I am going to here draw the three cell. Let's suppose this is the one cell, and this is the second, and this is the third. So let's suppose if I am going to put a stress on this cell has to undergo different kind of changes, or we can say different kind of growth adaptation. So let's suppose if I put a stress on this cell, and this cell undergo growth adaptation and increase its size. So this is called hypertrophy. Hypertrophy simply means increase in size of cell. And if that cell will keep its size but only increase the number of cells. So if the cell size is maintained but the number of cells are increased, it is called hyperplasia. So hypertrophy, size increase, hyperplasia, number of cell increase. And the third thing, if I put a stress and that cell decreases its size, it is called atrophy. So I know I am explaining again and again these terms, but trust me, some of the students still, when we start the system, I just want they don't like confuse, or they don't mess these terms with the other terms, because there are a lot of different terms. So you guys have to like clear your concept in a simple and easy way. So that's all about the atrophy. Now let's discuss about the metaplasia. Just so let's discuss about the metaplasia. So first of all, again, we have to understand the basic definition. What is the metaplasia? So basically, to understand this, I will again take an example of one cell. So let's suppose this is an example of one cell, and you are going to place a stress. Okay? You are going to put a stress on this cell. So when you are going to put a stress on this cell will change its cell type. Again, please listen. when you are going to put a stress on a cell and that cell or that organ changes its cell type, it is called metaplasia. So what is metaplasia? When you are going to put a stress on any organ, that stress can lead to change in the cell type of that organ. It is called metaplasia. So if they ask from you, when the cell is going to change its cell type, so what is the most common, you can say, epithelium which can be involved? So basically in the cell type, the most commonly change epithelium is surface epithelium. And we know that we have different kind of epithelium: squamous epithelium, columnar epithelium, urothelial or transitional epithelium. So these are the different kind of epithelium. And let's suppose if I say the squamous epithelium is going to change in columnar, it is a metaplasia. If a columnar is going to change in squamous, it is a metaplasia. And if the urothelial or transitional is going to be changed within other epithelial, it is called again metaplasia. So basically metaplasia is simply change of a cell type. When a cell is going to change from one epithelium to another epithelium, it is called metaplasia. So please always keep this in mind. So let's take an example to understand this. First of all, we have to understand why this metaplasia is going to occur after stress. Let's suppose I am going to take here one example of esophagus. So here is the esophagus and below that we have the stomach. And we know that in between the esophagus and the stomach, there is a one junction which is called lower esophageal sphincter, which is closing the esophagus and not along the gastric content into the esophagus. But we know that there is a one condition which is called GERD, gastroesophageal reflux disease. In GERD, what happens? The acid will go from stomach to the esophagus. And when the acid is going from the stomach to the esophagus, that acid is going to put a stress on the epithelium. Now, after when the epithelium is going to face that acid, that epithelium will change its type. And that change in type is called metaplasia. Let's try to understand uh, this with an example of this one. So here I mentioned the example of Barrett esophagus. Basically, Barrett esophagus is example of metaplasia. So here is the normal esophagus. In the normal esophagus, we have the squamous lined epithelium. But what happened in Barrett esophagus, when the acid is going from stomach toward the esophagus, that acid is going to put a stress on the esophagus epithelium. And that squamous epithelium cannot handle this stress. And that stress will lead to change of epithelium. That squamous epithelium is going to be changed with columnar epithelium. So in the normal esophagus, we have squamous epithelium. But when there is a more acid that is going from the stomach to the esophagus, that squamous epithelium is going to be changed with columnar epithelium. And that columnar epithelium is non-ciliated and mucin producing. So please keep in mind, this is called the Barrett esophagus. So Barrett esophagus is simply the changing of esophagus epithelium from the squamous type to columnar type. So just keep in mind. And another thing they can ask from you, how the metaplasia will occur. So basically, metaplasia will occur with the reprogramming of stem cell. So just keep in mind, this is important MCQs, how the metaplasia can occur. It can occur with the reprogramming of stem cell. And another thing, always keep in mind, metaplasia is reversible. It means if you treat the gastroesophageal reflex disease, your epithelium is going to be normal. Your squamous epithelium is not going to be columnar. So it means it is always reversible. But please keep in mind, if you will not treat this GERD, it can lead to the esophagus cancer. So it means metaplasia can become dysplasia. Basically, dysplasia we will discuss in the next slide. Just keep in mind, dysplasia is a pre-cancer state. So here I mentioned Barrett esophagus can go into adenocarcinoma. So basically Barrett esophagus, it is a metaplasia of esophagus, and adenocarcinoma, it is the cancerous state of esophagus. And here is one again exception. In our body, there is one exception, and that is apocrine of breast metaplasia. It means when a breast will undergo metaplasia, be, it is not going to convert in cancer in future. So this is the condition which you guys have to keep in mind. Apocrine of the breast, it is a benign condition, it is a metaplasia, but it is not going to be dysplasia, or it is not going to be cancerous. So that's all about this slide. So let's take another example. Here I mentioned the vitamin A deficiency can cause metaplasia. So how vitamin A deficiency can cause metaplasia? Let's discuss. Let's please first let me zoom. So first of all, you guys have to understand the normal or basic concept. Normal vitamin A is necessary or required for the differentiation of specialized epithelial surfaces like we have conjunctiva. So in the conjunctiva, we have squamous epithelial lining. Vitamin A is required for this squamous epithelial lining differentiation. So if a person has vitamin A deficiency, so when the vitamin A is deficient in the body, the surface lining of the conjunctiva will not undergo differentiation. So when the cell will not undergo differentiation, it can lead to different changes in the eye. That is called cratomlacia. So cratomlacia basically it is a change, and that change will occur when the vitamin A is deficient. So what will happen in this change? The squamous lining of the conjunctiva will not undergo into difference. So this is an example of, you can say, a metaplasia. They can ask from you the cratomlacia. It is an example of hypertrophy, atrophy, hyperplasia. You just have to keep in mind it is an example of metaplasia. So that's all about the metaplasia. So let's discuss another important example, and that is the question that you guys have to see in the U word. When you are going to solve the U word question, you will get this question. So let me explain with an example. They will give you a question. A person came to you in your office, and he says, "Doctor, I was running, I was walking in the playground, and suddenly a horse kicked me." Kicked on my, let's suppose, leg, and after that I see there is one kind of mass in the leg, and when you see the radiographic imaging, you see, you check that there is a formation of muscle, there is a formation of muscle in the bone. So they will ask from you, what is what is an example of this change. So first of all, you guys have to keep in mind the connective tissues which are present in our body, they can also undergo metaplasia. And a classic example of this connective tissue is myositis ossificans. So what is myositis ossificans? It is a condition in which connective tissue within the muscle changes into bone after the trauma. So what is myositis ossificans? Let me write here for you guys. Myositis ossificans. Myositis ossificans. So first of all, you guys have to keep in mind myositis ossificans is an example of metaplasia. So what happened in this myositis ossificans? Basically, it is an example in which person get trauma, and after the trauma, connective tissue within the muscle is going to be changed into bone. It's mean when the bone is formed in the muscle, it is called myositis ossificans. Normally, in the muscle, you get the muscular tissue. You will not get the bone. In the normal healthy person, in the muscle only the muscle tissue is present. In the bone, only the bone tissue is present. But in some cases, after the trauma, you will get the bone in the muscle tissue. So this is called myositis ossificans, and they can ask you in the exam. It is an example of metaplasia. And another important thing we are going to discuss is dysplasia. So first of all, what is dysplasia? Basically, it is the disordered cellular growth. Disordered cellular growth is called dysplasia. So if they ask from you what is dysplasia, so simply you have to pick, it is a disordered cellular growth. It is called dysplasia, and it is the proliferation of precancerous cell. As I already explained, a Barrett esophagus, it is a metaplasia, and if it is going to be like, let's suppose if it can convert into dysplasia, because if you cannot control the GERD, it can lead to the esophagus cancer. So we already discussed that dysplasia, it is a simply precancerous cell condition. And here I mentioned the example, cervical intraepithelial neoplasia into cervical cancer. So basically, cervical intraepithelial neoplasia, CIN mean cervical intraepithelial neoplasia. It is an example of dysplasia. But if you cannot like treat this condition, it will become the cervical cancer. It will become the cancerous condition. So please keep in mind. And if they ask from you what are the causes of dysplasia, so if a person has prolonged hyperplasia, if a person has prolonged metaplasia, these both condition can cause dysplasia. Please keep in mind. Another important thing, dysplasia is always reversible. As you guys uh, studied before, the metaplasia is reversible, same like that. Dysplasia is also reversible if the stress is removed. And if the stress is not removed, it is going to be cancer. So that all about the dysplasia. Now let's discuss another important terms that is aplasia and hypoplasia. So first of all, what is aplasia? It is a condition in which the failure of the cell production occur during the embryonic period. So when there is a failure of cell production during the embryonic period, it is called aplasia. What is an example of aplasia? Like renal agenesis. I will explain with an example. Just first try to understand the basic definition. And the second is hypoplasia. So what is hypoplasia? When there is decrease in cell production during the embryonic period, it is called hypoplasia. So when the cell is totally failure to produce, it is called aplasia. But when the cell is produced, but its decrease, its amount is decreased, it is called hypoplasia. So failure of cell production, aplasia, decrease amount of cell production is called hypoplasia. So what is an example of hypoplasia? Streak ovaries. Basically, it is a syndrome which is called Turner syndrome, and it only occurs in female who has 45 X chromosome. 45. Normally, there are 46 chromosome. In the male, we have 46 XY, and in the female, we have 46 XX. So, in Turner syndrome, what happened? There is one X chromosome deletion. Only female has 45 X chromosome. So, in the Turner syndrome, female has ovaries which are underdeveloped. Ovaries, those ovaries which are underdeveloped, those are called streak ovaries. It means their cell production is decreased. So this is an example of hypoplasia. So let's try to understand with this example. This is a normal baby, and a normal baby has two normal kidneys. And you see, this is a first left kidney, and on the right side, this baby doesn't have any kidney. So it means there is a failure of one kidney. There is failure of production of one kidney, and it is called aplasia. So in aplasia, totally failure occurs. So please keep this in mind. And on this other side, hypoplasia, you can see this is the kidney, and this is the second kidney. And in the second kidney, you can see the overall basically cells number are decreased. So this is an example of hypoplasia. They can ask from you in exam. Let's suppose they will say if a female has Turner syndrome and she has streak ovaries. So streak ovaries are the example of hypertrophy, hyperplasia, aplasia, or hypoplasia. You have to pick the hypoplasia. Then they can ask from you a unilateral renal agency. If the person has one side of kidney and other side he didn't have, it is called unilateral renal agenesis. And unilateral renal agenesis, it is an example of, you can say, aplasia. So that's all about today. So basically, today we just only discuss the basic, we can say, terms that are coming in the growth adaptation. And from tomorrow, we will discuss the second topic, that is the cellular injury, in which we will discuss the reversible or irreversible different kind of cell injury types. So please always keep this in mind. So that's all about today.